the critical message of the NHS is that every citizen is entitled to high quality healthcare free of charge. Free of charge.
Hi, I'm Shoma Chaudhury. Thanks for watching Enquiry. India has been going through a tragic and apocalyptic few weeks, and there's been a lot of discussion about the terrible mistakes made by our government and us as a society. So as we struggle to come out of this mess, it's crucial that we take our learnings from other countries as well. The UK, for instance, has had a very difficult encounter with COVID, a harsh second wave, and yet a successful vaccine rollout. So what are the lessons that we can draw from there? To discuss that, I have an extraordinary speaker from Britain today, Sir Malcolm Grant. Sir Malcolm was the founding chair of the National Health Services, which is almost seen as a religion in UK, and where he presided over a staggering £130 billion budget. He's also been the Pro-Vice Chancellor of Cambridge, the President and Provost of the University College of London, and is currently the Chancellor of York University. He's also the head of the Plus Alliance, which is a coming together of 3 universities across the world: the Arizona State University, the University of New South Wales, and King's College London. Their focus is on sustainable change, public health, social justice, and the responsible innovation of technology. So he's ideally placed to discuss the future of pandemics, public health, and the role that technology can play in all our lives. To speak to us from the pit of a crisis, thank you very much for joining us, Sir Malcolm.
It's a great pleasure. Thanks for the invitation.
Sir Malcolm, everyone across the world, as well as internally within India, has been very critical of our government for the way that we have handled the pandemic. And we're really going through an apocalyptic time. And I don't want to take away from our accountability and culpability. But both the US and UK have also had very rocky trajectories with the pandemic. So I wanted to start with your assessment of UK's response to the coronavirus. And do you think, what is your assessment? Was it successful? Were parts of it successful? What would you say on that?
It's almost too early to tell. I would say that for us in the UK, yes, it has been apocalyptic. I don't think that's too strong an expression. We're currently looking at 130,000 deaths from this. And the only way you can put this into context is to, I think, in 2 ways. First is to compare that with the annual death rate from other causes. And this exceeds the normal annual death rate from coronary heart disease, from cancers, etc., and also seasonal influenza. So seasonal influenza has been almost absent this year because people have been taking such precautions to try to prevent the spread of infection. But if we look at this, we can see a significant number of premature deaths that would not otherwise have occurred. And if the only way to normalize this is not to look at the gross number of deaths, but to look at the deaths per population, per 100,000 or per million of population. And in the global league tables for that, the UK and the US are still amongst the highest. For 2 very wealthy nations, this raises a number of questions about how well our political leadership have actually handled the crisis. I have to point out that at this stage, and we're now talking in early May, the reported deaths per million in India are far, far lower. I mean, we would be expecting, if we applied a multiplier of population as between the US and the UK for India, that India's total death numbers would be in the 2.5 millions. It's nowhere near that. We know that the official estimates of death in India are way below the actual occurrence. And all of the data across the world has to be treated with some caution because different countries have been measuring it on a different basis. But I would say at the moment, if we look at the course of the progress of the pandemic across these countries, India had a very flat curve to start with. What is different is how steep that curve has become in just the last month. So let me go back to the question of why is it that our governments have not handled this particularly well? I would say that in a common course between the UK and India was a period of complacency. There was a sense that this was a problem of elsewhere. There was a sense in the UK as we started out in March or April 2020, we could see steeply rising curves of the disease in Italy, which was the hotspot in Europe at that time, and a belief that that was somehow a peculiarly Italian phenomenon. It was only as the curve started to rise in the UK that the panic measures started to set in. By panic measures, that's probably the wrong description. I mean, a government that had up until then believed that the British public would not accept a lockdown. It was quite, we are not China, they said. Look at Wuhan. Wuhan locked down straight away. Singapore, South Korea, countries which have had a very small impact of the pandemic. The British mindset, I think, was, well, those are countries that are used to authoritarian governments and can be locked down immediately, and we can't do that. I think what then startled our political leadership in this country was the fact that the British actually did accept lockdown. We're actually quite disciplined about it because they could see the bigger picture. I won't say that hasn't been uncontroversial. There have been a lot of protests and demonstrations, but nonetheless, that meant that through the first wave of the pandemic, there was a political response which then started to bring the numbers down. We then, as with India, we then went through a period through last summer in which we thought we'd conquered it. Actually, the scientists were still warning about a second or third wave, but we came through a very difficult period in which there was enormous stress on our healthcare system, and then we all relaxed. Summer, 2 or 3 months over last summer, were fine. Now, at the same time in the United States, of course, political leadership was in the hands of Trump. He gave confused messages. He didn't believe in the disease. He held rallies without masks, something similar to what we've seen in India more recently. And I think the political leadership in both the US and the UK diverged significantly from the fundamental corpus of scientific advice. People had seen the SARS crisis in Southeast Asia. People understood that this had the potential to be immensely more damaging. In the UK, we've paid the price. So the last wave, which started in about October, November last year, and is about to come to an end, I think, has seen 2 or 3 times the pressure on our health service. It's seen our hospitals struggling to cope with the incidence of this awful disease. And with political leadership that took a long time to adapt, took a long time to shut down on human interaction, but has now, I think, reached the point where the number of deaths per day in the last week has averaged about 7 across the whole of the UK. That's a remarkable change from deaths of over 1,000 a day. Now, remember, our total population is about 65 million as opposed to India's 1.4 billion. So again, these deaths have to be put into context. So there have been a number of points of learning for the future from this pandemic.
So I'm going to come to ask you what those learnings are, because one is particularly interested in that, lessons and learnings. But, you know, when I was listening to you speak, there's this whole prevention paradox, you know, that India went into a very precipitate lockdown. And while that may have been wise, I think the criticism was that Mr. Modi didn't plan enough for it, you know, to shut a country down in 4 hours led to its own horrific, outcomes. But for countries that have sort of gone in for lockdowns and prevented it, we built a certain amount of infrastructure. But when we didn't hit the kind of peaks, the complacency in a way was inevitable. Like people started packing up the infrastructure, all those extra hospitals and field hospitals were packed up. And, you know, and then if things don't escalate, people will also think that's unnecessary expenditure. So how do you handle that, Sir Malcolm? Even right now, I was just reading that UK, after the vaccination rollout, Clive Dix has said the virus will be obliterated by August. And there are another set of scientists saying prepare for a third wave. So in all fairness, how are political establishments supposed to respond to this?
I think it really is very difficult. The whole paradox in healthcare is the balance between the investment that we put into treating illness and that which we put into prevention. And actually, in terms of human consciousness and in terms, I think, also of political response, the answer has always been to go for the treatment of illness, because that's where you see the greatest harm and the greatest damage, which can be put right. We know that we can operate on a broken leg. We know that we can fix things in the heart and in the brain to some extent. And that becomes the highest priority, as opposed to anticipating how we can improve the health of the population at large. I mean, frankly, the most dramatic thing we've ever done on that is reduction in the levels of adult smoking. The consequence in terms of the rate of cardiovascular disease in the United Kingdom is absolutely dramatic. But that was a 40-year campaign, like wearing seatbelts in cars. And I understand it completely. Politicians want to be able to give good news, uplifting news, especially if there's a general election in the offing. So there's a tendency to behave in a certain way. But against that, I think that politicians around the world, with perhaps the exception of places like New Zealand, politicians around the world have been wanting to say, it's all over. We can now lift the constraints and people can go back to normal lives. Even as I speak here in London, we're doing that. We're saying, from next week, you can hug your grandchildren. Well, that's wonderful, and we all want to be able to do that. But there is a sense that at least this wave of the crisis is over. Now, you talk about scientists, and of course, there is not a single science. There is divergence, because we're not talking so much about the precision with which science identifies and characterizes and sequences a particular virus. We're talking about risk. And scientists can give an evaluation of risk. What is the likely transformation of this virus as it goes through different mutations? What is the likelihood of its incidence? What is the proportion of the population that it might hit? But it's the politicians ultimately who have to take the view about how acceptable is that risk? What's the likely impact? We know that there will be X thousand deaths per year from other causes. What's the level of excess risk that we are willing to accept on behalf of our population? It's very difficult for politicians to be open and honest about that. Any politician who says, well, we can take another 50,000 deaths is just heartless. It's just not an appropriate way to couch it. And yet, inevitably, behind all of this has to be a calculation. I think that the countries that got this calculation right were the ones that said there is no conflict between health and prosperity of the nation. The two have to be melded together. If we take the long-term view, then shutting down the economy in the short term may be the best investment we make for prosperity in the longer term. But politically, I do understand how difficult these decisions are to take.
So, Marco, I'm still going to circle back to the learnings and the more granular aspects of this, but just very broadly, I'm still trying to understand this, that how, now in the hindsight of this 1 year, and you've been chair of the National Health Service, which is almost seen as religion in Britain. So you really know this up close, that how reliable are these scientific models? Because I was looking back to India last year, there were some models which said, almost 300 million people would be affected, 3 million might die by July. And then when all of that didn't happen, when people are now predicting that there's going to be a second wave and a third wave, what is that? What measure do we use for reliability? And the ancillary question to that is that if we are now going to look at wave after wave, that every time you open up, there's going to be another wave, how are societies meant to react to this? So if you were in the PM's position right now and could take the decisions, what would you do?
I think that's a very, very interesting question. I mean, modeling is, in some senses, it's a statistical artifact. We learn from past epidemics. We look at all the possible variables, and we come up with predictive models that indicate a certain impact. But of course, it's much more than statistics. It all depends upon, well, what are the inputs to the model, and how are they balanced, and how will those affect the output? So I think we started off badly in the UK because we had set up already a number of expert groups to advise the government. But the government initially refused to disclose who was in these groups, who were the scientists, and what was the record of their meetings, what was the advice the government was getting. That, I think, was most unfortunate because it allowed us all to speculate that the government wasn't following the advice, wasn't listening to the advice. I think we learned from that, that the critical thing to keep in public trust was we have to know who's giving the advice, we have to understand what, at least in outline, what's the basis of the advice? What are the assumptions that it's predicated upon? And then what's the government done about it? So that, I think, has been a big learning. That's all now much more open. And also, we have now a number of very distinguished epidemiologists, virologists who are willing to take a role in the media, who are willing to talk to the media. Now, sometimes this doesn't work because they give different perspectives, but that's actually, the public are intelligent enough to understand that there is no unitary forecasting coming out of this. Secondly, as the pandemic has progressed, so we've been able to understand, well, how accurate were the models? How accurate were these forecasts? And how have they been adapted as we've gone through the pandemic? So I think, I hope, and I think it's true, that there's probably more faith now in the UK in the modelling and in the experts who've come out of their dark rooms and come under the public gaze, have been cross-examined by the media, and have actually given quite a good account of what they're doing. Ultimately, still, of course, it is for the politicians to assess how closely. Every politician will tell you they're following the science, but there isn't a science. So we start with that. There are many sciences. And secondly, they have to be very upfront, I think, about what choices they're making and why. I'll just give you one example. One question was back in the autumn and leading up to Christmas. The scientific advice was very strongly, we should go for a circuit breaker. We should go for, let's say, a few days lockdown complete and just bring the current rise in cases under control. And the politicians didn't do it. They delayed, they went on. And ultimately, I think, now hindsight is great, but I think we ended up with a far greater toll of death and misery and pressure on the National Health Service as a result of delaying and not moving sufficiently quickly.
I'm going to still press you on that question of what you would do if you were in a position of leadership right now to take a decision for UK. Now that you've kind of seeming to have got it under control, vaccination has been rolled out. Would you right now start opening the economy, or with all the knowledge you currently possess, would you stop the society from opening up?
No, I think it's right to go cautiously on that. And if it were just within the UK, if we had complete control of our borders, yes, I think that we could steadily open up the economy. Again, New Zealanders, by the way, I'm a New Zealander by background, but New Zealander is a standout case. They have, 5 deaths per 100,000 people or whatever it is. It's way down there. So is China, by the way, because if you can control your borders, that's a significant reduction in risk. And then if you have high levels of vaccination of your population, so we're now 68% of the adult population in the UK has had a single jab, about 35% has had 2 jabs, so the level of vaccination is going up, and that's been a major factor in bringing down the incidence of the disease. So I think that would give me the confidence, if I were a politician, and I'm not, that would give me the confidence to say, now we can start to reopen the economy. The other thing is that the National Health Service went through the most appalling pressure. Of course, we see every night the scenes from India. It was not at that level, but it was our own version of that. In a wealthy nation with significant investment in healthcare, it was taken almost to the limits of the National Health Service provision. So the nation is very cautious about going for too rapid a reopening of the economy when it sees the damage that the disease can wreak on that institution and on the population.
So in fact, you mentioned about the National Health Services coming under huge pressure. And I wanted to ask you that what we're seeing in India right now is it's a completely horrific breakdown of coordination as well. It's a logistical coordination between gathering of data, oxygen, medical protocols, of course, infrastructure itself, access to beds, to doctors. Like every aspect of the chain has broken down. Did the UK have to suffer that as well in terms of just coordinating between data scientists, what they are saying, just what the appropriate medical response should be? What were the biggest challenges for the National Health Service?
I think for the National Health Service, most of those factors were not present because it is a single service across the whole of England, separate for Scotland and Wales. Single service across the whole of England with a well joined up data model and with a sense of a single institution not competitive institution. And as you said earlier, it is almost like a religion in the UK. It's the most trusted institution in the UK. It's way above the BBC and the royal family and the judiciary. So that meant that people understood that the NHS was there for them. And would do its best. Within the NHS, there were dramatic changes because there were whole areas of medical specialism that were no longer being used because we had shifted people out of hospitals. We were voting at one time 40 to 50% of hospital beds were occupied by COVID patients. So that people who might have been dermatologists or other areas came in to help in intensive care units. People voluntarily gave their help. The public voluntarily gave their help to come in and help within the hospitals. And we didn't suffer the shortages of oxygen that we see in India, although there were places where we came quite close to that. And the data, I think, has been an important part of this. And I'll just explain why. Data privacy in healthcare is an immensely important thing. And the advocates for data privacy have been very strongly against healthcare data being circulated too widely. For the emergency, that was set aside. We were able to have data flows that followed the patients, which allowed the best treatment to be given, but also, and this is really important, allowed research to be done in real time, so that we could actually follow not only the course of the disease through populations, but we could also do clinical trials in hospitals. So the clinical trials were conducted by something called the Oxford Recovery Unit, looking at what interventions actually were best. And by using the data across whole lots of hospitals in the UK, we came up with some profound changes in the way in which patients were treated. So I'd say that the impact on the NHS was severe. The government, however, responded by upping the investment in the NHS significantly. And we've been through a period of austerity, and that was, I think, partly why the NHS wasn't better prepared for a pandemic. The nation wasn't actually well prepared for a pandemic. What we were very well prepared for was seasonal flu epidemics, but this was a multiplier of severity greater than those, and we were not well prepared for that. For future, that's lesson number one that the government has to think of. There will be more pandemics. How do we ensure that we do not make the mistakes that we made in 2020 and 2021?
Yeah, in fact, that's been one of the big challenges for us. We recently had a number of scientists write an open letter to the Prime Minister and the government saying that they weren't getting data in real time and that this was really prohibiting the science in a big way, that even something as basic as how many patients were hospitalized, how the treatments were impacting them, even the genome sequencing of the virus for new mutants, all of that has been crippled by the absence of data sharing in India. So that's a really important point that you're making. So that brings us, I'm going to come and ask you specifically about your perspective on India, but your learnings and lessons from this entire experience in the UK, what are the biggest takeaways that you would like to put out?
Act quickly and act decisively. In other words, we didn't really close our borders until relatively recently. So cases were still coming into the UK. It's one of the reasons I think why the UK and the US were hit so hard by this pandemic is that they're very open societies and people come and go. They're international transport hubs. So that I think is one. I think we just have to lock down very quickly to protect the health of the nation. I think the second learning for me is actually very positive, which is I gave a speech at about this time last year, more about early March last year, in which I said a vaccine is at least 2 years away. The logistics of actually cracking the virus, designing the vaccine, manufacturing it, distributing it, 2 years away, and I was wrong. I mean, I think to me this has been the most extraordinary experience that one could have imagined, that a vaccine could be ready for use within, 9 months of hitting it, and we could then be rolling it out to billions of people around the world at the speed that we have. So that, I think, has been a fantastic learning. And we now have our universities working closely with the pharma companies with the ability, I think, to identify what are the new variants that are coming through, what are the tweaks that we may need to make to a vaccine. We're now talking about giving everybody in the UK a third boost come the autumn. And it may be a variant on the existing vaccine. That I think, if we can normalize this into the process that it becomes like the seasonal flu vaccine, then that's a major precaution for the future. I have to tribute to the universities in this country and elsewhere, and to the life scientists, but also to the whole process of genomic sequencing that we invested in the NHS 5 years ago, which has allowed us to rapidly sequence the virus each time and discover these variants, and then think about how successful the current vaccines will be against these variants and what changes may need to be made in the future. This is the highest level of genomics, and it's served us very well.
And so, like you said, that's the positive end of it. But in terms of just negative lessons, what do you think has been learned, apart from like having to shut down the borders faster?
I would say the other thing is getting people accustomed to wearing masks in public. At the beginning, the scientific advice was, well, we don't know. The scientists were actually saying no reason why it should make any difference at all. I think we've now changed that. We now understand that human behavior and interaction is absolutely critical here. What we would have done without Zoom, I don't know. It has actually made it possible for many people to continue working. But, and this is a point that's really relevant to India and to the UK, what about those people who can't work from home? Great bulk of the population whose employment depends upon them going out, circulating, working, delivering, and doing all of these other things. And although we can test the population, and we can advise people that you've been in contact with somebody who has the virus, you should stay at home. Many of these people won't. They just can't afford to stay at home. They'll be unemployed if they stay at home. And so that, I think, has been something that we haven't yet fully understand or conquered. We've invested billions into testing and tracing, but it hasn't been a successful investment in this country.
So, when you spoke of the National Health Service and the fact that it has such a, elevated position in UK society, what makes it that? What are the components that makes it so successful? And what is the kind of spending, of GDP, just for our audiences to know? Of course, the scale of India and UK is so different that we have to keep that in mind. But one's really long-term learning about public health is about the infrastructure. So can you help us understand what is the triumph of the NHS and how much does the government spend on it? And is there buy-in for that?
Some quick data points then. Okay, so the critical message of the NHS is that every citizen is entitled to high-quality healthcare free of charge. Free of charge. Okay, so people pay often some contribution towards drug prescriptions, etc., and sometimes for opticians and dentistry, but the bulk of healthcare is free, and that resonates with people. When I say it's free for the user, but it's an impost on the tax. So about 90% of healthcare in England is paid for out of taxation. That makes it the second largest aspect of government spend. Just to put it in financial figures, the current budget for the NHS in England is about £130 billion a year. To put it in GDP figures, as you suggested, is about, it's just rising to 10% of GDP. GDP is not a particularly useful comparator because it depends on the state of GDP, what the percentage is. But if I tell you it's 27% of government spend, then that puts it into perspective.
But even 10% of GDP is great just in terms of psychologically of how much a society is willing to spend, because we spend 1.2% of our GDP on our health, so that is really the oceanic gap in how.
And by the way, our figure of 10% is low amongst the OECD countries. America wastes something approaching 18% of its GDP on healthcare because it has a very dysfunctional and broken system. But normally you would see France, Germany, and the Scandinavian countries up at about 11, 12 or more percent of GDP. Actually, a more accurate figure is often, well, how many dollars is that per capita of people? So again, I find that quite useful. So if we normalize that into spending power, in the UK, it's about $3,600 per capita. And in America, it's about $10,500 per capita. So there are huge disparities. But oddly enough, there's no obvious link between the amount you spend on healthcare and the health of the population at large. This is interesting because the health of the population at large is, of course, a factor of so many other variables. It's what we eat, it's our genes, it's how we behave, and how much exercise we get, etc.
I'm going to come and ask you how, countries across the world can have greater battle preparedness for a landscape that's going to get, more and more intense. But before that, what is your assessment of where India is at? When you're just looking at it from a distance and you do have an interest in collaborating with India, what do you think are the really cardinal errors we've made, and what can we fix, in the Indian context, not in an ideal world?
At the moment, I have no idea of what is the trajectory in India. I'm really worried when I see so steep a curve over the last month. And also by the reports that are very common, which is that the data collection in India is not actually very accurate. We know that many deaths are not recorded, and so we don't really know the true incidence of the disease. What we can see, of course, is its horrific impact on the health system in India, which is not as well funded, as you've just pointed out. It's not as well funded as anywhere else. So there are two aspects to this, Shoma. I think, first of all, how do you hold back the disease and its incidence? And secondly, how do you treat it for those who are actually affected by it? We've got to put much more now into the first of these if we're to avoid the chaos that we see in the second that has occurred across the world. And I think for that, early warning systems, I think a constant alert on the transmission of the disease, both within countries and between countries. I think thirdly, continued scientific investment in vaccines and in characterizing the virus, and seeing, because I think, as with malaria, ultimately with infectious disease, and we thought by and large we'd captured infectious disease around the world. Well, we haven't. I think ultimately it's vaccination and the development of some model of herd immunity. But with this virus, we don't even yet know what herd immunity means. Sweden did an experiment with herd immunity and has suffered one of the highest mortality rates in Europe as a consequence of not acting sooner. So we're still learning. It's impossible to reform the healthcare system in the course of a year or two. India has to embark upon a 10 to 20 year trajectory on this. For years, I've heard very distinguished politicians and others in India say, India's got all the tools to do this. India is so advanced in data analysis. It's got so many small entrepreneurs. It's got fabulous industrial style hospitals, such as that of Dr. Devi Shetty. I'm a great admirer of what he does. You can turn things through much more quickly with better results and with lower costs. But somehow this has to convert into a national aspiration, properly identified as a strategy, properly funded in order to transform the quality of healthcare in India, not just in the cities, but out into the villages using telemedicine. We know that this is all possible, and actually India can be a world leader on this, but somehow the aspiration hasn't yet crystallized into delivery.
That's a crucial thing. When you mentioned even about just knowledge and knowledge sharing, and I'll come to your Plus Alliance and what you seek to do across borders. But even within India, one of the breakdowns, there's the whole logistical aspect. We're an oxygen surplus country, yet we haven't been able to get oxygen, not even to the national capital. There's, of course, the scarcity of the vaccine, scarcity of medicine, scarcity of beds. It's horrible, But one other aspect of it is that there isn't even a sort of protocol of response, and I was keen to ask you whether this is true, that the National Health Services sends out a kind of update to every wing of its service on a daily basis. And there's a kind of protocol of response that even a doctor in a village would have access to. Is that true? And how is that managed? And do you think that's replicable in India in a pandemic like this? So for instance, in our hinterlands, a primary health center doctor may not know how to read the disease. How can we do this kind of information sharing?
Yes, it's true of the NHS because it's a single institution. Well, it's a single institution-ish because different hospitals, employ different people, etc. And there are 35,000 general practitioners who are self-employed, all of that. But putting that to one side, it is able to respond in a unitary way, in a unified way to a pandemic such as this, and data is collected, data is distributed, and the leadership are visible and talking about it almost on a daily basis. In fact, almost every day when the Prime Minister was doing a live press conference, there would be the chief medical officer and the chief scientist alongside the Prime Minister in that. And that was communicating not just to the population at large, but also to the health services, what the priorities were and what was happening. So that, I think, regular communication should not be underestimated.
In fact, that's been another big disappointment in India, that our Prime Minister has not been having those daily press conferences or daily briefings about where we are at and what is the logic behind the thinking or what is being done. So I totally take that point about how important communication is in the midst of a pandemic.
I know that every so often prime ministers of India come up with new announcements about massive investment in healthcare and what it's going to look like and new models of insurance, but it's taken the NHS 75 years to get where it is today. It's not yet perfect. I think an interesting comparison is with America. America doesn't have a perfect healthcare system, and American hospitals were under great pressure. However, their rollout of the vaccine has been spectacular. Again, a wealthy country, again, with help from the military and other logistic agencies, they've been able to do something which I would not have forecast. They could have done at the pace that they've done it.
So in fact, the vaccine rollout, even in the UK has been a big success. So yes. What are the facets of that? You just mentioned the military, and I think this logistical aspect of health in a pandemic is being underestimated. I personally feel, in addition, because we have excellent doctors, we have, under the circumstances that India lives in, huge dedicated medical profession, but it's just a logistical nightmare right now. And I don't think our government's on top of that at all, So what has helped UK roll out its vaccine in a way that its response to the pandemic wasn't so good, but the vaccine rollout has been good? What are your learnings from that?
Actually, I think there's just one answer to that. It was the NHS. First of all, there was the component of how the vaccines were procured. And the government authorized a special vaccine task force without interference from government ministers. So that was really spectacular. They invested billions in some of the major pharmaceutical companies, and in the Pfizer and the AstraZeneca, spectacularly, which is an Oxford University discovery. They invested the billions into helping them to develop the vaccine and to manufacture it. So it was an upfront payment to procure supplies of the vaccine. So the number one question is the supply route for the vaccine? And I know the Serum Institute in India had enormous aspirations. We were all looking to what it could provide, and it's run into difficulty for complicated reasons, partly getting the raw materials from the US, et cetera, et cetera. So I think that was number one. And then secondly, having managed to procure the supply was the rollout. And the NHS, as a structure across the country, was the agency for that. And that has worked extremely well. So it's a combination of using doctors, but also my inoculation was given to me by a physiotherapist. I mean, other people with some clinical experience, or hardly any, were able to come in and participate almost on a voluntary basis to roll this out. So thirdly, there was a clear prioritization. Nobody got the vaccine simply by paying for it. Everybody got it for free. You couldn't buy it. But then we started with the most vulnerable groups, the over 80s, people with severe underlying health conditions, and then we came down decade by decade in age range. So that now even my children are getting the vaccine. That seemed to be to the public to be absolutely fair and absolutely explicable. So there was a discipline about it. And now there's a huge bounce back in terms of public affection for the NHS. And indeed, we had a series of elections last week in which the current government came out victorious, and everybody says, well, that's the vaccine bounce. People are feeling happier again.
So I'm going to come to the personality at the heart of this, which is Sir Simon Stevens, who's also sort of reported to you in the past. But before that, just listening to you and distilling what you were saying, one big aspect then you're saying was government's willingness to spend on the vaccine, which our government has not. I mean, we didn't even place enough orders with the Serum Institute. So that's been a big thing. And the other thing you mentioned is about this lateral entry of human resources, which, again, doctors and scientists have been calling for our government to bring in first-year students, second-year students, medical students, people who are still waiting to get their degrees, but infuse the system with more medical practitioners. And for some reason, we are dragging our feet on that as well. So that's two big learnings that we can take from the UK. But to come to this idea of having a kind of war room, Sir Malcolm, we've been feeling the absence of a war room in India, but Sir Simon Stevens has been really celebrated by everyone as well. You know him well. What do you think he's got right? And what did he make mistakes on in handling the entire pandemic?
It's a very good question. Yes, I appointed Simon. And as you know, he's just recently announced he's standing down. He stayed on for an extra year, actually, because of the pandemic. I would say Simon got absolutely right that this was an operation that required the proper organisation across the NHS. So he took the leadership on that. He kept out of national politics. He didn't want almost the NHS to be tainted by political choices. He said, my job is to deliver what the NHS has to do. And I think he's done that extremely well. I have to say, he's one of the smartest people I've ever come across, and immensely able, as you would have seen from the many tributes that have flowed in as he's announced that he's stepping down.
So I know you're in a bit of a rush, Sir Malcolm, but I just wanted to touch on the Plus Alliance, that its focus again is public health, use of technology, cross-border collaboration. Can you just spell out what the vision is, and also what would you like, and in what ways would you want to collaborate with India? Or have you been trying to collaborate with India?
My vision about this is that universities are fantastic agents of change. And we've seen this actually in the course of the pandemic. They can do stuff that no other organization can do. They've got very smart people in all sorts of areas of intellectual endeavor. And one of the ways in which we can help to transform society is to bring that together on a cross-disciplinary basis. So if that's true of a single institution, imagine what you can do if you bring three of them together on three different continents, which is what we've done with the Plus Alliance. King's College London, Arizona State University, University of New South Wales, led by fantastically visionary presidents. And the idea is to see how we can actually, from this, do the sorts of research and the sorts of interventions that one university couldn't do on its own. So one of these areas that we're working very hard on at the moment is the healthcare workforce of the future. And for this, fascinated to be able to collaborate with partners in India and elsewhere. There's a global shortage. We've been training our healthcare workforce in the norms of the 19th century and in the disciplinary silos of the 20th century. We've got to have to recruit a vast new workforce of millions of people, most of whom have been brought up in a digital era and have a completely different way of communicating with each other and of using data, analyzing data. And this is something that I think the Plus Alliance can make an enormous contribution to.
Could you just describe that a little bit more? Because it's something that we can do in the future. In what shape would that take? When you're saying that it's a whole new digital generation, what would this health workforce?
What is astonishing at the moment is the convergence of a whole array of new technologies in healthcare. I anticipate that healthcare can be transformed in 10 years. I mean, one of the big problems is how do we do that at a cost which we can afford? Most new technological changes in healthcare, in my experience, have raised the cost rather than reduced it. But how can we reduce cost by the convergence of technologies around wearables, miniaturization of sensors, the advances that we're making now with whole genome sequencing to understand propensity towards disease, to improve the quality of early detection of disease and early intervention of disease. I think cancer can be transformed in as little as a decade because of these new technologies. But they need newly trained healthcare workforce to cope with them. Some at the highest level of bioinformatics, being able to use data and to understand data, and others at the level of being able to use their skills remotely. because I think with 5G and 6G and 7G and everything that's going to come along will transform our ability to reach remote populations who are often left behind by the current models. So we're working very closely, particularly with King's College London and the NHS, but also in the other two jurisdictions to understand what are the cultural changes that are needed, what are the changes to our curricula that are needed, and how are we going to bring benefits to the population at large.
Thank you very much. I mean, there's a lot more I want to explore, but that now that you're in a rush, just to end on that, if you had a predictive capacity right now, both for the US, UK, and India, the three big democracies, how do you see the year panning out? Do you see another wave after wave of the pandemic, or do you think this is under control now?
I think we will see future waves. There is a clear correlation with weather, not just the weather, but the fact that people living outdoors more and more are less likely to infect others. So we've always seen this with seasonal influenza. It's a seasonal thing. So I would anticipate there will be further waves. What we don't know yet is what variants will emerge between now and then, and what will be their effect and what will be the impact of the vaccines that we've developed. The optimist in me says, actually, we're pretty well prepared. We're certainly much better prepared for a future wave than we have been in the past, and vaccines will have been a major contributor to that.
Thank you very much, Sir Malcolm. It's been a pleasure talking to you. Thank you.
Thank you very much. Thanks a lot, Shoma. Goodbye.